Did you know lung cancer can sneak up on you, even if you've never touched a cigarette? It's a shocking truth that can't be ignored. Today we will uncover the hidden signs of lung cancer that could potentially save your life. Get ready for a jaw-dropping revelation that will make you rethink everything you thought you knew about this deadly menace. Greetings, thriving beings, and welcome to the channel, Body Thrive. In this video, we're going to explore the early signs of lung cancer. Now, I know what you might be thinking. I've never smoked, or I don't have a family history of lung cancer. So why should I worry about lung cancer? Well, buckle up because we're about to debunk that myth. Contrary to popular belief, lung cancer doesn't discriminate based on smoking or family history. So if you've never touched a cigarette in your life, you could still be at risk. That's why it's crucial to understand the early signs and symptoms, even for non-smokers. Stick around as we unveil the surprising yet life-saving information everyone should know about this disease. It's time to begin. Number 10. Lingering cough. Let's begin our countdown with a common but often overlooked sign of lung cancer, a lingering cough. This isn't your typical cough from a seasonal cold or allergies. We're talking about a persistent cough that sticks around for weeks or even months. Paying attention to the seemingly harmless symptom is vital because it could be an early indication of lung cancer. According to studies, nearly 80% of lung cancer patients initially experience a persistent cough. So, if you constantly find yourself reaching for cough drops and your cough just won't quit, it's time to take it seriously. Next on our list is shortness of breath. Number 9. Shortness of breath. Now, we all feel a little breathless after running up a flight of stairs or engaging in intense physical activity. But if you're experiencing shortness of breath even with minimal activity, it could be a red flag. Lung cancer can obstruct the airways, making it harder for oxygen to reach your alveoli, the tiny air sacs in the lungs that allow rapid gaseous exchange. This can leave you feeling exhausted and gasping for breath. So if you find yourself panting after simple tasks like tying your shoes or walking a short distance, it's worth getting it checked out. But wait, we're not done yet. Prepare yourselves for our 8th warning sign. Number 8. Chest pain. The chest pain, a symptom that often sets off alarm bells in our minds. While chest pain can stem from various causes, it's important not to dismiss it when it comes to lung cancer. Lung tumors can put pressure on the chest wall or invade nearby tissues, leading to discomfort or sharp pains in the chest. Now remember that not all chest pain is linked to lung cancer, but if you're experiencing persistent or unexplained chest pain, it's wise to consult your doctor and get it evaluated. Chest pain is also particularly concerning as it could also be a sign of serious heart issues, such as heart attacks. So if ever in doubt, do not hesitate to get emergency care. Now let's dig into our 7th sign, unexplained weight loss. Number 7. Unexplained weight loss. We all want to shed a few pounds, but when weight loss occurs unintentionally, it's time to take notice. Unexplained weight loss, especially significant amounts, can be a warning sign of lung cancer. Cancer cells can increase your metabolism and cause your body to burn calories at a faster rate, resulting in unexpected weight loss. If you've been dropping pounds without trying to or noticing changes in your appetite, it's essential to investigate further and rule out any underlying health issues. But hey, don't run out of energy just yet because we're moving on to our 6th sign, fatigue and weakness. Number 6. Fatigue and weakness. Feeling tired and lacking energy is something we all experience from time to time. However, if you find yourself constantly tired and weak, it could be more than just a case of needing an extra cup of coffee. Lung cancer can lead to fatigue and weakness due to the body's immune response to the disease. Additionally, cancer cells can release substances that affect your metabolism and energy levels. If you struggle to get through the day and even simple tasks drain you, it's worth discussing with your healthcare provider. Next up is our 5th sign, hoarseness or voice changes. Number 5. Hoarseness or voice changes. Have you noticed a persistent hoarseness or change in your voice? This might not be a clear case of cheering too loudly at a sports event. Hoarseness or voice changes can be a subtle sign of lung cancer. Tumors in the lungs can affect the laryngeal nerves that control the vocal cords, resulting in a raspy or deepened voice. If you've been sounding different lately or experiencing persistent hoarseness that won't go away, it's time to get your voice checked out. Take a deep breath because our 4th sign is chronic respiratory infections. Number 4. Chronic respiratory and chest infections. When we talk about early signs of lung cancer, it's important to address both chronic respiratory infections and chest infections, as they can be distinct yet interconnected. Let's break it down for you. Think of chronic respiratory infections as those pesky, recurring upper airway issues. We're talking about sinusitis, that relentless stuffy nose and facial pressure. Then there's sore throats, with their persistent discomfort and irritation. And let's not forget about pharyngitis, that scratchy feeling in the back of your throat that just won't go away. These seemingly innocuous infections can actually serve as warning signs of an underlying lung condition, including lung cancer. On the other hand, chest infections are all about the lower respiratory tract. We're talking about the heavy hitters here, like pneumonia and bronchitis. These lung infections, also known as chest infections, can cause symptoms such as persistent coughing, mucus production, chest congestion, and difficulty breathing. When these infections become chronic or keep coming back, it might be a sign that something more serious is going on in your lungs. Remember, both chronic respiratory infections and chest infections can be potential early signs of lung cancer. But don't swallow this fact too quickly, because our third sign is difficulty swallowing. Number 3, difficulty swallowing. Swallowing should be a seamless and effortless process. But if you're experiencing persistent difficulties or discomfort while swallowing, it could be a cause for concern. Lung cancer can sometimes press against the esophagus in the chest or cause inflammation, leading to difficulty in swallowing or feeling of food getting stuck in your throat. If you've noticed changes in your ability to swallow, it's time to bring it up with your doctor to explore the potential underlying causes. Now prepare yourselves for our second sign, coughing up blood and blood in mucus. Number 2, coughing up blood and blood in mucus. When it comes to lung cancer, coughing up blood or finding blood in your mucus can serve as a crucial early sign. However, it's important to note that the presence and severity of blood can vary depending on the stage of the disease. Coughing up blood, also known as hemoptysis, is a red flag that something is not right within your respiratory system. In the early stages, you might notice small streaks of blood in your mucus or phlegm. At this point, the amount of blood might be minimal, and you might not experience any other noticeable health problems. It's essential not to dismiss these early signs, as they can indicate the presence of lung cancer. As lung cancer progresses, the amount of blood can increase. In later stages, coughing up blood can be more prominent, and it may comprise a significant portion of your coughs. This progression highlights the correlation between the severity of lung cancer and the presence of blood in the respiratory system. Regardless, it's crucial to take it seriously. Number 1, new onset wheezing. And now we've arrived at a highly significant sign to watch out for, new onset wheezing. While wheezing is commonly associated with conditions like asthma, all that wheezes is not asthma. Rather, it could be something far more dangerous. Unfortunately, wheezing can also be an early indication of lung cancer. Tumors in the lungs can cause narrowing of the airways, leading to wheezing or whistling sounds in the chest during breathing. So if you've recently noticed a whistling or squeaking sound when you exhale or inhale, it's time to take it seriously. Don't brush it off just as a temporary annoyance. Consult your doctor to get to the bottom of it and ensure your lung health. Disclaimer. Please note that the information presented in this video is simply for educational purposes, and it should not be considered a substitute for getting medical advice or medical care from a healthcare provider. We've uncovered the early signs of lung cancer. Now let's shift our focus to 7 preventative measures and natural remedies that can help reduce the risks and potentially reverse the disease. Remember, it is easier to take the steps to prevent a disease than have to fight it later on. Harness the healing power of herbs. Herbs are like tiny superheroes in the world of natural remedies. Some herbs such as astragalus, licorice root, and echinacea have been used in traditional medicine for their immune-boosting properties. These bad boys can help strengthen your body's defense mechanisms, making it more resilient against cancer cells. Whether you incorporate them into your meals, brew them into a tea, or take them in supplement form, these herbal warriors are here to support your battle against lung cancer. However, just like any food, you can sometimes consume too much of a good thing, so it's best to consult with your healthcare provider or a nutritionist to discover which herbal remedies are best for your body, while also making sure they're taken in the right quantities and combined properly with other foods or other supplements you may be taking. Quitting smoking. While much of our focus is on non-smokers, it's essential to address the significance of quitting smoking for those who currently smoke. If you are a smoker, quitting is the single most effective step you can take to reduce your risk of lung cancer. Seek support from healthcare professionals, join cessation programs, or explore nicotine replacement therapies to increase your chances of successfully quitting. In addition to quitting smoking, which is vital for current smokers, there are other proactive steps you can take to protect your lungs. Breathe in fresh air. The quality of air we breathe can have a significant impact on our lung health. Avoiding exposure to harmful pollutants such as secondhand smoke, air pollution, and workplace toxins is essential in preventing and reversing lung cancer. Make your home a smoke-free zone. advocate for clean air in your community, and take the necessary precautions to protect your lungs if you work in an industry with potential exposure to toxins. After all, breathing in fresh air is much sweeter than inhaling harmful fumes. Eating more plant-based foods or adopting a plant-based diet. Numerous studies have shown the benefits of consuming a diet rich in fruits, vegetables, whole grains, and legumes in protecting against various cancers, including lung cancer. Adopting a plant-based diet can fuel your body with antioxidants, phytochemicals, and fiber that help combat cancer cells. Consider incorporating leafy greens, cruciferous vegetables, berries, and nuts into your meals to give your body a fighting chance. Now, let's shift our focus to another crucial preventative measure: regular screenings and early detection. Early detection is key to successful treatment. Regular screenings such as low-dose computed tomography, CT scans, can help detect lung cancer in its early stages, even before symptoms manifest. If you fall into a high-risk category, such as being a long-term smoker or having a family history of lung cancer, consult your healthcare provider about appropriate screening options. Maintaining a healthy immune system. A robust immune system plays a vital role in protecting against lung cancer. Focus on maintaining a healthy lifestyle by getting enough sleep, managing stress, and staying hydrated. Additionally, incorporate immune-boosting foods into your diet such as citrus fruits, garlic, ginger, and green tea. And remember, everything in moderation. Love, laugh, and live. And finally, in the battle against lung cancer, love, laughter, and living life to the fullest are potent weapons. Positive emotions, social support, and stress reduction have been shown to positively impact overall health. So surround yourself with positive vibes, embrace joyous moments, and find beauty in the simple things. If you've ever had lung cancer, share your journey with loved ones, join support groups, and seek inspiration from others who have triumphed over adversity. Remember, you are not alone, and together we can conquer lung cancer. Being proactive in your health is crucial. If you experience any of these signs, don't ignore them. Consult with a healthcare professional for further evaluation and guidance. And always keep in mind that lung cancer can affect anyone, regardless of their smoking history. Thank you for joining us on this journey through the early signs of lung cancer. Your commitment to educating yourselves and taking charge of your health is truly commendable. Remember, knowledge is power, and by sharing this video with your friends and family, you can help spread awareness about lung cancer and potentially save lives. If you found this video helpful, don't forget to subscribe to our channel for more life-saving health tips. Let us know in the comments if anything in this video surprised you or what tip you liked best. And be sure to click the notification bell icon to stay updated with our latest videos. Take care, stay healthy, and remember, early detection can make all the difference.